the major one, affecting the majority of dogs getting older. Yes, exactly. Benign hyperplasia or benign prostatic hyperplasia. So it's the most common disease. So we could say, okay, we treat this dog for benign prostatic hyperplasia. If he's not better, then we will make an investigation. That's the first thing we could do. Otherwise, we can do a further investigation right now. Depends on how precise you want to do. So what was done a lot in the past was X-ray. Do you think it's a good, very accurate examination to diagnose benign prostatic hyperplasia? So some people say no. Who thinks it's not the case? It's not very good examination. So only the people on the left. So in fact, it can be a good examination, but on X-ray, the problem is that we tend to overestimate the size of the prostate. So it's very difficult to really say that you have an enlarged prostate. Normally you have to have less than 70% of the distance between the sacral rim and the pubis, but it's a little bit difficult. We consider that if it's really very large, if it's more than 90% of this distance, then you should suspect not only a benign prostatic hyperplasia, but even a cancer, a prostatic cancer when you have a very, very big prostate. So probably to assess the prostatic volume, it's not very good. Some people prefer a ventral view, but I would say that nowadays that we have other methods of investigation, and I will speak in a minute about ultrasound, probably ultrasound is a better technique to assess the state of the prostate. So I would say that ultrasound is probably one of the most important exams to see if there is a prostatic problem. And when affected, in fact, the prostatic gland will always take an abnormal ultrasound aspect. So when you are going to make an ultrasound prostate, you are going to check for the prostatic size, the echogenicity of the prostatic parenchyma, and eventually the presence of some cysts in the prostate. So how many of you are doing quite commonly ultrasound of the prostate? Very few. So among you who are doing ultrasound of the prostate, which of these three elements would you consider as the most important to suspect benign prostatic hyperplasia? Is it the first one, prostatic size, the echogenicity of the parenchyma, or the presence of cysts? Tricky question. So personally, I think that it's echogenicity and eventually the presence of cysts. The volume of the prostate, we will see it in the next slides, is very difficult to assess on prostatic ultrasound. So measuring the size of the prostate is interesting to follow the treatment when you are going to treat the dog to see if it works or not, because you are going to repeat the examination over the months. But if you only measure the volume to see if the dog has a big prostate, it's not so easy. Why? When you have benign prostatic hyperplasia, most of the time the echogenicity changes quite quickly. It becomes a little bit heterogeneous. You have very quickly some very tiny cysts that appear all over the parenchyma, and then you see that the prostate may not be normal. So so let's speak about this criteria. For the size, usually the way you measure the prostate is to have two views, one transverse, one longitudinal. The longitudinal view is done by having the bladder neck, so in French it's vessie, bladder, and then you have the urethra that you are supposed to see on all his length, and then you can measure the prostate on the longitudinal view, on height and length. And on the transversal view, you need to have a symmetrical view of the prostate, and it's the same, you are going to measure the height and the width. So I will tell the ones of you who are doing prostatic examination. Is it easy to get this? No, it's not easy. This is theory, it's what you find in books, but in reality, the ultrasound of the prostate is not such an easy examination to perform. There are many dogs who have a prostate that doesn't resemble at all like this. They can be very long, or they can be very thick, or they can be not symmetrical, or they can have prostates in which it's impossible to see on the same view the bladder neck and all the urethra, which is most often the case. So in fact, it's not very easy. So there is only, to my knowledge, one study that really studied in Beagle dogs the characteristics of the length and the height and widthness of the dogs, comparing with the size of the dog and the age of the dog, and they made some tables to see that for a Beagle dog the prostate should be under this level in the different dimensions, and at the end they calculated the volume that depended on the size of, on the weight of the animal, poids in French, and A, which is the age of the animal. So in fact, if you want to be very accurate, there are many variations depending on the breed and on the age, because you know that most dogs after 5 years of age they will have a big prostate, but it's not because of this, that it's pathological, just that they have a big prostate. And some breeds, like for example Scottish Terriers, which is a well-known breed, they have a bigger prostate compared with their size, and even though it's not pathological, so that's a problem. So there are simplified formulations to calculate the volume depending on the length and the width and the height of the prostate. And so from this, at least, you can calculate the initial volume of the prostate before you begin your treatment. It will be the point zero to see what was the prostate at the beginning of the treatment. So be careful that it's not 100% accurate. If you change a little bit the inclination of your probe, you may have big variations on measuring the dimensions, either on the longitudinal view or on the transversal view. So there are some tricks to manage to do a better evaluation of the prostate. Depends on the clinician. I don't know how, for example, Maria would perform the ultrasound on the prostate, but I know that as a whole it's recommended to have a full bladder. It's easier to see the prostate because it's pulling a little bit the prostate. It's better not to have too much inclination of the probe, and sometimes it's even easier in some large dogs to have the dog standing on the table rather than lying, and you will see better a prostate without having to change the inclination of your probe too much. I don't know if you have any comment on this. I will give you the microphone.
As a routine, I prefer checking the prostate as a standing position with the gallbladder. Yeah.
Thank you. So this is this was a thesis of one of my students who did a study on measuring the prostate. So in fact, it's the same prostate of the same dog made by two different operators at 10 minutes interval. And you see the aspect of the prostate, the general shape is completely different. So in fact, not only it depends on the equipment, on the way you do it, but also it has to be always the same operator doing the examinations. Otherwise, you have no comparison point. And it's the same when you do a transversal view. If you are just changing a little bit the inclination of the probe, it will change completely the image you will get. So after that, you have to put the cursor in the right position. You see that here it was put here, probably it was more here. And here it was put here, which was completely wrong, so it should have been here. So on the transversal view, if you press too much with your probe, you can have a flat aspect of the prostate that will be very large and not so having a big height. So that's the limitation of this technique. In reality, in theory, very nice, but in reality, not so easy. So that's why, personally, I prefer to rely on, as a first criterion, on echogenicity. And this dog had an heterogeneous prostate. You see that there were some hypoechogenic zones and some zones that were more hyperechoic. Two things. First, it doesn't mean that there is a prostatic pathology. When in the studies that we performed, my previous resident Xavier Levy worked a lot on prostate, and what he found is that if the prostate has a normal echogenicity, you can nearly 100% say that there is no prostatic pathology. But when you have a change in echogenicity, it doesn't mean that there is a pathology. It's not enough to say it. But at least, if you have nothing wrong, then probably the prostate is normal. And second thing I would like to say about this dog is that this dog just ejaculated, and the fact that he has ejaculated can change a little bit the echogenicity of the prostate. So, of course, because you find blood in the sperm, you are going to make an examination of the prostate, and when you see this, then you suspect really that there is a problem. But it would be wiser to see the dog a few days later, maybe 3-4 days later, not after an ejaculation, to confirm that there is a change of echogenicity of the prostate. I don't know if I explained well enough. So be careful when the dog has just ejaculated. This was the view we had on the transversal view, so a little bit heterogeneous also. So beware, ultrasound after ejaculation is not very indicative. So just to remind you, I don't know if you know, in Western Europe now we have also a blood test that is commercialized under the name of Odelis. It's measuring an enzyme which is CPSE for canine prostatic secretory esterase. It's an analog of the PSA, the enzymes that are increased in the blood in case of a big prostate. I don't know if you have this test in Estonia. So it's quite useful when you have no ultrasound available to confirm a prostatic enlargement. So indeed, there was a study that was done comparing dogs with BPH and without BPH, and the test was highly significant. When you have a big prostate, you have a clear increase of CPSE under threshold values. So this is something that can help you to convince the owner that there is some treatment to be done on the prostate of the dog. So of course, compared with rectal palpation, I don't know, maybe with rectal palpation you can see that the prostate is a little bit enlarged. So the bad tongue, if I can say, but a little history, that this test was mostly developed for British people because they consider non-ethical to make a transrectal palpation in the dog. So they prefer to have a more stylish test, making a blood sample than putting a finger in the ass. So I don't know if it's true, but it's the little history. So let's speak about benign prostatic hypertrophy, so that we suspect very much in this dog. So majority of dogs after 5 years of age have a big prostate. So in fact, at the beginning, what is happening, you've got an hyperplasia, so an increase of the size of the prostatic cells, and multiplication of these cells, so an hyperplasia and an hypertrophy of the cells. And to the difference of humans, in fact, the prostatic cells and the receptors to testosterone are mostly inside the parenchyma and not so much around the urethra. That's why in dogs, in fact, having prostatic problems, you have less urinary problems than in men. Usually you have other problems first, like hematuria or intermittent hematuria, eventually pain, and eventually some problems in defecation. So you have what happens on the hormonal point of view. So all this is androgen dependent. It depends on testosterone. So testosterone is reaching the prostatic cells, the prostatic parenchyma, and it's transformed into its active metabolite. Sorry, it's not so easy to see with this color, which is called DHT for dihydrotestosterone. And in fact, this dihydrotestosterone has a stronger binding activity to the androgenic receptors than testosterone itself, and a much lower dissociation coefficient, so it has a prolonged action compared with the testosterone itself. And the enzymes that transforms testosterone into dihydrotestosterone is called the 5-alpha reductase. There is another thing happening, especially in dogs getting older, is that part of the testosterone is transformed by aromatase into estrogens, and so you get an increase of the number of estrogens that, in combination with dihydrotestosterone, are going also to change the parenchyma of the prostate. It's what we call a metaplasia of the prostate, and it will increase the prostatic symptoms. And then the dihydrotestosterone is linking with the receptors and is activating the messenger RNA synthesis, and then goes into the increase of prostate. So what are the consequences of BPH, benign prostatic hyperplasia? Can be known. It's the majority of dogs. They just have a big prostate and that's all. They don't suffer from it. So the problem, of course, is nowadays, do we have to consider only clinical BPH, dogs having symptoms, or dogs without symptoms, just having a big prostate? In other terms, you have a dog coming in consultation for anything, vaccination or whatever. You palpate the prostate, you see that the prostate is big. The owner says, oh, sometimes he has some problems in defecation, but that's all. You have to treat the dog. The debate is open. But you can have some other diseases that develop after BPH on the second term, like prostatitis. We will speak about this later, about cyst, abscess. Or just the dog will develop what we call a prostatic syndrome, having some digestive problems, having sometimes difficulties to stand up, and all that. And it can also develop some infertility. This is some data that is under publication at the moment, that was done by one of my previous residents, Emmanuel Fontbonne. In fact, at the vet college, we have two kinds of people in which, for their dogs, we diagnose prostatic problems. We have dogs coming for bad quality semen, so mostly breeding dogs that come in consultation because some of the bitches that have been mated are infertile, so they come for spermiogram. We discover that they have a bad quality semen. We examine the prostate and we see that there is a prostatic problem. And we have dogs, mostly belonging to private owners, dogs that don't mate, who come for a prostatic syndrome. And what we discovered is that, in average, we diagnose the dogs that have a bad quality semen nearly 3 years before the mean age of diagnosis of dogs who have a prostatic syndrome. In other terms, it seems that one of the first steps of the development of a prostatic pathology is an alteration of the sperm quality. So this is interesting, at least in breeding dogs, to detect early enough that there is a problem going on. So now the problem is when to begin a treatment. There was an attempt on this that was done by our colleague Daniele Zambelli from Bologna University, who presented in the World Congress in Vancouver in 2012 a study of an index to know, depending on the age of the dog, or depending on the clinical signs and the intensity of the clinical signs. He proposed this table. Of course, I'm not going to detail it. If you are interested, I will send you the article, in which, in some cases, it's not necessary to begin a treatment. In other cases, he would recommend beginning a treatment. So that's quite interesting. Furthermore, in this dog, you have an heterogeneous prostate. So, of course, because benign prostatic hyperplasia is the most common disease of the prostate in dogs, it's probable that he has only this. But it's not the only pathology. First, no, this is not so interesting. Okay. It doesn't matter. This slide is not in the same. So we did also a study on the age of appearance of BPH. It's in average in dogs getting quite old. You see 8.6 years in average among our clients. And so, in fact, when we see about prostatic problems, they are different prostatic problems. Most of them are linked with prostatic enlargement, so due to BPH. But there are there is another pathology in which we don't know if testosterone is really linked with it. It's the cancer, prostatic neoplasia. And there are even some controversial data showing that maybe castrated male dogs have an increased risk of developing prostatic neoplasia. So in our data, we find prostatic diseases. This is also in the work that has been submitted on epidemiology. We mostly find it in large dogs. And this is what I wanted to speak about. When we speak about the different pathologies, you see that you have a majority of BPH, but you have quite a high number of dogs that are having a prostatitis, an inflammation of the prostate. But don't consider that prostatitis is something completely different from BPH. Very often, prostatitis is the second step after the initial development of a BPH, of a benign prostatic hyperplasia. So the diseases are very often linked together. So if you treat a dog only for BPH, and if you have recurrence of the pathology, you should think that maybe there is a prostatitis associated with this BPH. So you may have BPH, prostatitis, you may have cysts or abscesses, or even neoplasia. So that's why, and if you remember only one thing from this presentation, I would recommend that when you want to treat a dog for BPH, you do an ultrasound of the prostate, then you are going to make a treatment to diminish the size of the prostate, and you have to control the prostate 1 month or 1.5 months later.